Elon Musk's Neuralink first human patient controls their mouse with their mind. Things are heating up. Let's dive right into it. So what we're going to cover in today's video, we're going to talk about Neuralink's brain-computer breakthrough, understanding the Neuralink technology, Neuralink's first patient video, and then Neuralink's potential benefits, applications, and then some ethical and transparency considerations. Let's dive right into it. Neuralink's brain-computer breakthrough. So first human Neuralink implant. Neuralink's first human patient has successfully controlled a computer mouse through thought after being implanted with the computer's brain chip technology. Recovery and control. The patient has fully recovered without any known ill effects and can move the mouse cursor on a screen by thinking. The current focus is on achieving as many mouse button clicks as possible through thought. And then technology details. The Neuralink device implanted by a robot uses over 1,000 electrodes to record brain activity and translate it into computer commands. The initial application, named Telepathy, aims to help individuals with paralysis control digital devices. So just from hearing that, I mean, we'll get into this, first in a second. We're going to have some people that are like, it's going to be like kind of like politics. We have the left and the right. Some people are going to be, eventually it's going to be like some people want to get implanted, some people don't want to get implanted, and things are going to get crazy. But I mean, just from hearing that, obviously, not saying I would want to get implanted, but I mean, that'd be pretty cool to be able to control the mouse with your mind. I mean, obviously, sometimes if you're working on a computer all day, you can kind of get like tendonitis with your hand by clicking so much, or it's just, being able to control it with your mind would be a lot easier, right? I'm not saying that that's something I would want to do, but I mean, over time, as we start to see these more advances, you're going to probably start to see first people with disabilities or Alzheimer's or whatever get these huge breakthroughs. Eventually, though, we'll probably start to see people start to kind of like become these cyborgs. And, for example, like if someone's able to run a business a lot more productive than someone else or do a certain task, then other people are going to want that competitive advantage. So that's kind of going to start getting a little dicey once we get to those stages, which are going to be a lot sooner than people think. Anyways, clinical trial progress. The FDA approved PRIME study began recruiting in fall after approval in May. The trial involves participants with quadriplegia from cervical spinal cord injury or amyotrophic lateral sclerosis, ALS. Future potential. Elon Musk envisions the technology restoring lost capabilities such as vision or motor function. However, the company has faced scrutiny over safety protocols and transparency. I mean, like, this is crazy technology that we're seeing. I'll also insert a video somewhere in this video of the Neuralink having a monkey being able to play Pong with its mind. And they were doing monkey trials for a long time. This is a breakthrough with the first human trial. And this is just honestly, to be honest, quite frankly, no pun intended, this is shocking. All right. This is just straight shocking. I'm literally stunned making this video. So please send help, guys.
Progress is good. Patient seems to have made a full recovery with no ill effects that we're aware of, and is able to control the mouse, move the mouse around the screen just by thinking. So we're trying to get as many button presses as possible from thinking. So that's what we're currently working on is, can you get left mouse, right mouse, like mouse down, mouse up, mouse, left mouse, sort of left button down, left button up, which is like kind of needed. Like if you want to like click and drag something, you need the sort of mouse down and to hold on mouse down. And then there's, we want to have obviously more than just two buttons. So we're trying to make progress on that front, but overall it's looking very good.
Understanding Neuralink's technology. So how it actually works, Neuralink's brain implant records neural signals and electrodes placed near brain cells, allowing the user to control devices with intended movements. The bigger picture. So this advancement could revolutionize assistive technology for people with disabilities, potentially restoring independence in daily tasks. So, all right, so just to go over a few things here, we're going to take a look at the Neuralink website. So our mission, create a generalized brain interface to restore autonomy to those with unmet medical needs today and unlock human potential tomorrow. So quick question for you guys, quick little poll. Let me know in the comments down below. Would you actually do Neuralink? Would you put this thing into your brain? Would you put it into your brain? I want you to answer that question first. Would you put it into your brain right now? And some people, I'm assuming most people will say no, heck no, or maybe there'll be like some people to say yes, but you're answering that question with what you know today, with where Neuralink is and where you are in your current state. Maybe in 2 years from now or 5 years from now, that answer may be different. All right. Maybe Neuralink, like I said, if you see someone completely outperforming you in whatever task, whether it's physical, mental, whatever, you may start to get that competitive urge that, this person's making so much more money or getting so much desired results with this Neuralink implant. I want that. All right. So that could be your driving factor in the future. But let's just say, for example, you lost some sort of function in your body, whether it's moving, like you're disabled, or maybe something in your brain happened. You met with an unfortunate accident or something like this. Obviously, we don't ever want that to happen, but in that situation, even right now, there may be a higher percentage of you that would actually do this. So I know I'm saying this just because some people right off the gate are like, no, I would never do this. I would never do this. But in certain situations, you actually may be more likely to do something like this. So brain-computer interfaces have the potential to change lives for the better. We want to bring this technology from the lab into people's homes. That's potential impact. Who is this for? We're currently focused on giving people with quadriplegia the ability to control their computers and mobile devices with their thoughts. And then our approach, we keep the people with who will use our products in mind, emphasizing safety, accessibility, and reliability during our engineering processes. And then what's next? In the future, we hope to restore capabilities such as vision, motor function, and speed, and eventually expand how we experience the world. So this is just a start. We have the implant. So our brain computer interface is fully implantable, cosmetically invisible, and designed to let you control a computer or mobile device anywhere you go. This is the implant right here. So if we go through, we have biocompatible and enclosure. So the N1 implant is hermetically sealed in a biocompatible enclosure that withstands physiological conditions several times harsher than those in the human body. Battery. So the N1 implant is powered by a small battery charged wirelessly from the outside via a compact inductive charger that enables easy use from anywhere. Chips and electronics. So advanced custom low power chips and electronics process neural signals, transmitting them wirelessly to the Neuralink application. Advanced custom low power chips and electronics process neural signals, transmitting them wirelessly to the Neuralink application, which decodes the data stream into actions and intents. And then threads. The N1 implant records neural activity through 1024 electrodes distributed across 64 threads. These highly flexible, ultra-thin threads are key to minimize the damage during implantation and beyond. So, surgical robot, the threads of our implant are so fine that they can be inserted by the human. They can't be inserted by the human hand. Our surgical robot has been designed to reliably and effectively insert these threads exactly where they need to be. Base structure. So the base structure and motion stage provides the surgical platform for the robot head and primary 3-axis linear motion used to position the robot head and needle. Robot head. The robot head contains the optics and sensors of 5 camera systems and the optics for an optical coherence tomography OCT system. Needle. The needle, which is thinner than a human hand, grafts, inserts, and releases threads. And then to restore independence and improve lives, we built a brain-computer interface BCI experience that enables fast and reliable computer control and prioritizes ease of use. Patent registry, so you can register there. And yeah, it uses like you get an app on your phone and everything to control it and all that cool stuff. So first patient video. So here is the first patient video. Really crazy. I'm going to play it right now.
The joy of connecting with your loved ones, browsing the web, or even playing games using only your thoughts. This is made possible by placing a small, cosmetically invisible implant in a part of your brain that plans movements. The device is designed to interpret your neural activity so you can operate a computer or a smartphone by simply thinking about moving. No wires or physical movement are required. By participating in the PRIME study, you'd be helping to redefine the boundaries of human capability. If you've been living with quadriplegia from a spinal cord injury or with ALS, you may qualify for the PRIME study. We'd love to share more with you and get you on board. Visit our website today to learn more and to submit your application. We'll be supporting you with a dedicated team at every step on this revolutionary journey. Your courage and contribution could significantly shape the future of interaction and independence, not just for you, but for countless others.
All right, so that is just really crazy. This is just the start. Like I said, I mean, we're just getting started in all this with AI and biotech and brain implants turning into cyborgs. So what are some of the Neuralink's potential benefits and applications? And I will touch on some of the potential negatives or things that people are on both sides of the spectrum, right? I'm not saying that Neuralink is bad. I'm not saying it's the best thing. I'm just gonna show you what the potential benefits are and what some people are really scared about too. So medical advancements and neurological treatments. Neuralink's technology could revolutionize the medical fields by enabling control of prosthetics and computers for individuals with paralysis or motor function impairments. The brain-computer interface BCI could restore communications for patients with conditions like locked-in syndrome and aid the treatment of neurological disorders such as Alzheimer's disease, epilepsy, and depression, even blindness. So pretty crazy, life-changing stuff for those people. Enhanced human capabilities. Beyond medical applications, Neuralink aims to enhance cognitive abilities, potentially allowing for faster information processing and memory improvement. The technology could lead to new human-AI interaction, enhancing sensory experiences, and possibly leading to telepathic communication. Literally, imagine like a world where we all had these Neuralinks in our head, and they were controlled by some crazy advanced level AI like GPT-8 or GPT-9. Not saying we want OpenAI's AI in our head or whatever, or probably want like an open source type thing or whatever, but who knows, right? Let's just say like some world where whatever AI is the most advanced one, we have it in Neuralink or something like that. You're basically communicating telepathically, and you're like a super genius cyborg, and I mean, you're just self-improving yourself in your own brain. Things would be pretty crazy. I don't know how the economy would work. You'd probably be able to just create like infinite money. I don't know if money would be even something that would be of value. Maybe it would just value would be created through like a different means, whether it's an intelligence or who knows how we would actually determine what's valuable or whatever. How would we reproduce? Would it be the same? How would we survive? Like all these different stuff. It's just crazy to actually think about. And these things that once maybe were science fiction are now actually not too potentially far ahead or too crazy to think of. Anyways, restoring lost function and independence. So Neuralink's BCI could help individuals regain lost sensory functions such as sight, hearing, offering a new lease on life for those affected by sensory impairments. And then by restoring autonomy to those with severe disabilities, Neuralink could significantly improve the quality of life and independence for many individuals. Future integration with AI, artificial intelligence. The long-term vision includes achieving a symbiosis with AI where humans could potentially compete with or complement advanced AI capabilities. So there could be pros and cons to this because obviously people look at it maybe as a dystopia. Some people look at it as like, okay, well, becoming cyborgs, it's almost like the next level of evolution. That's what Larry Page said, CEO of Google. But I mean, it could be maybe perceived in a good way if done right, or it could be a dystopia. Same thing with AI. So let me know what your thoughts are in the comments down below. This integration could lead to unprecedented advancements in technology, science, and human potential, reshaping our understanding of the human brain and consciousness. It's funny how, like, even as I'm making this video, it's like, yeah, I'm trying to give you an unbiased way so you guys can get your own thoughts on this. Maybe you already have your strong opinions, but even like you see advanced so-called experts in this space, whether it's AI or tech, in this day and age, a lot of them are just kind of like speculating. People really don't know what this new technology. I mean, for example, it's kind of funny. Sam Altman 10 years ago basically said that AI is going to be probably most likely destroy everything. Yet he's like the founder or the owner of the biggest AI company.
You know, I think AI will probably, like most likely, sort of lead to the end of the world. But in the meantime, there will be great companies created with serious machine learning.
And now we see this lawsuit with Elon where it's saying, you know, Sam Altman is, you know, making it closed source and for profit and all this stuff. It's just a really crazy time in this space. Anyways, ethical and transparency concerns. So calls for transparency. Critics have raised concerns about the lack of detailed public information on the trial, urging the ethical standards of transparency to avoid giving false hope to people with neurological disabilities, and regulation and ethical standards. Despite the FDA not requiring reporting for early feasible studies, there is moral responsibility for transparency from the medical professionals involved in the trial. And then analogy, imagining the brain as a sophisticated command center sending out signals. Neuralink acts like a highly advanced translator, converting these signals into a language that computers can understand, allowing thoughts to control digital devices as effortlessly as a conductor directs an orchestra. Now, one thing is, like, as we see AI advancing, we're pushing towards AGI. Let's just say, like, I'm gonna make a few more videos as well, potentially on different. I mean, there's a few different leaks going out right now. I don't know if I'll fully cover them because, you know, take them with a grain of salt. But there are a few potential people saying, like, for example, one thing is like AGI could be the amount of data or compute needed could be similar to the amount that the human brain has for different neurons in the brain. And it could be similar to the same number of, you know, like data points that the AGI would need. That'd be kind of interesting. Like, and then you see, so, okay, so maybe an AGI brain or AGI would be the same as or similar as what, you know, the brain would need. Okay, let's put AI or AGI, put an AGI system into Neuralink, into your brain. Then you're essentially just evolving the brain to be like that's what it is, being like a cyborg. So who knows? Some people will probably say that, yeah, it's the next evolution. Some people will say it's a dystopia and it could be the doom. We could get our brains controlled by Elon Musk or whoever or whatever. People may have their own personal intentions or bad intentions. Time will tell. I mean, this progression, it almost seems like it's inevitable with everything going on. But I mean, what do you guys think of this? What do you guys think of this? Let me know how you think things are going to progress with Neuralink. I'm going to play a video of Neuralink controlling monkeys playing Pong as well. So pretty interesting stuff. But before I do, guys, if you haven't already joined our free Accelerate Stride community, it's stridecommunity.com. All the links are scrolling right here. Links will be in the description. It's 100% free. So it's a bunch of free AI stuff. You can network with myself, like-minded entrepreneurs, AI enthusiasts, professionals in, you know, different businesses and whatnot, as well as learn a bunch of different stuff. I post exclusive content in there and exclusive things, prompts, etc. So stridecommunity.com, check that out. It's 100% free. Facebook group, Discord channel. Also, too, guys, the free 6-day Accelerate Your Stride challenge. I'll be hosting that soon. AI challenge, bunch of free stuff. People charge like thousands of dollars for like business courses and AI courses on this type of stuff. I'm giving it for 100% free in this challenge. I may charge a little bit later down the line, but right now it's free. So go secure your spot, accelerateyourstride.com. That will be launching very soon. And then also too, guys, a big milestone for me, I actually just wrote and published this book, Client Acquisition Code. So if you run a business, or if you're looking to start a business and you need clients for like your coaching business, consulting business, marketing agency, if you're a content creator, if you run paid ads, if you do outbound prospecting, cold email, LinkedIn outreach, whatever the case may be, if you use a CRM, if you use GoHighLevel, you need this book. Pour my blood, sweat, and tears to this, but more importantly, my heart and my soul. It's over 600 pages of non-fluff, pure value. And you can go and get your copy, your digital copy at clientacquisitioncode.com. You can also get 8 fast action bonuses that I provided there. Free course, free community, free AI stuff, templates, all that good stuff. Go check out clientacquisition.com. You won't regret it. It's only $27, less than a cup of coffee a day. And then there's a there's a 30-day trial guarantee. So if you don't feel like you get value from it, even though it's literally cheap, then just message me, shoot me an email, and I'll refund you. No worries. So you literally have nothing to worry about. There's no risk. Literally go check it out. And then lastly, too, guys, I mentioned CRM in this book. We use the best CRM in the world, GoHighLevel. It's the most affordable, as well as I literally built my whole business on it. Like, I'm not just saying this. Even if I wasn't letting you guys know about it, I literally spent the last 4 or 5 years building my business on this thing. This is what we use for our clients as well. We use it for clients that run, are just starting out, and we use it for multi-million-dollar clients that run multi-million-dollar businesses. We help them build out their GoHighLevel systems, and I built a custom-built snapshot, which includes all the automations, all the funnels, all the sales funnels, forms, all this stuff that you would potentially need to get started with GoHighLevel. And you can get that for free. People charge thousands of this as well for stuff like this. You can get it all for free just by signing up through GoHighLevel through our affiliate link. It doesn't cost you anything else. It's just literally the same as you would sign up through the GoHighLevel website. You can just go to gostride-level.com. There's a video explaining everything. There's a bunch of free bonuses again. Literally wanted to over-deliver for you guys with everything here. So go check that out. And it explains everything. Other than that, guys, I will see you in the next video. I'm going to play the monkey video right after I do my outro here. So keep hustling, keep grinding, and of course, accelerate your stride. Take care, guys.
As you can see, Pager is amazingly good at mind pong. He's focused, and he's playing entirely of his own volition. One of the things the Neuralinks allow Pager to do is to play his favorite video game, Pong. To control his paddle on the right side of the screen, Pager simply thinks about moving his hand up or down. We've removed the joystick altogether. Now that he's up to speed, let's increase the difficulty and see how well Pager can play with the Neuralink. We can interact with the Neuralinks simply by pairing them to an iPhone, just as you might pair your phone to a Bluetooth speaker. The links record from more than 2,000 electrodes implanted in the regions of Pager's motor cortex that coordinate hand and arm movements. Neurons in this region modulate their activity with intended hand movement. For example, some might become more active when he moves his hand up, and others when he moves it to the right. By recording from many neurons and feeding their activity into a decoder algorithm, we are able to predict Pager's intended hand movements in real time. It's not magic. The reason Neuralink works is because it's recording and decoding electrical signals from the brain. Great game, Pager. And what better reward for a monkey than a banana?